Hello, welcome back. The topic today is worms and anemia, worm infestation and anemia. So most of the people know, I have a worm infestation. They even ask, the patient will ask, give me some deworming medicines and all, because I have itching and all. But most of the people doesn't know these worm infestations can cause anemia, even severe anemia leading to cardiac failure. So there are so many worms like roundworm, hookworm, but generally the one which causes the anemia is hookworm. There are two types generally, Ancylostoma duodenale and Nicator americanus. These are the two types of hookworm that can cause anemia. So generally, these infected people or infested people, they pass these worm eggs in their motion. So this motion, suppose it's in the open, in the open defecation or in the forest somewhere, these motions they go. So the damp soil, these egg can hatch into a larvae, or sometimes it washed with the water, rain. So the damp soil, these egg change into larvae. These larvae are the one who are infected to the human beings. So suppose somebody is walking there, going there, so they can enter the body through the skin. So when it enters the skin, it reaches the blood vessels. Through the blood vessels, it goes to the heart. From the heart, it goes to the lung. So wherever the heart blood flow is very fast, it cannot do anything because of the flow. But when it reaches the lung, so the blood flow slows down and it starts giving medical issues, like people may have even cough, wheezing. So when they cough and they have a wheezing, or even sometimes they vomit, so they're from the lungs, it comes to the mouth. From the mouth, it goes to the stomach. From there, it goes to the small intestine. In the small intestine, these larvae attach to the small intestine walls. In the wall, it enters into the blood vessels. In the blood vessels, it starts taking the blood. It starts drinking the blood, in fact. So, and they grow into a mature adult. So people with these infestation over a period of time, they get anemia. So they present to the doctor with anemia, tiredness, the lack of immunity, or sometimes wheezing. All these things. The doctors, they will examine, then ask some questions, and if they are coming from an endemic area, some areas are endemic where these infections are very common, or if they have a pet animals, the same way, the pet animals, they have a different species, but the same cycle. It goes to the body, comes out of the body. The human beings touch with the play with the pet animals like cats and dogs. From the it can reach the human beings, causing anemia. So that is why we always say, don't walk barefoot, especially in the damp soil and or in the forest. That is very important. Number two, no more open defecation. That should be banned, because that is where it spreads. Number three, if you have a pet animals, they should be properly dewormed. They should be properly treated. But better to avoid the pet animals. And the next is, go to the doctor. They will do investigations, like very simple investigation is motion test. The motion, they will see the egg or the ova. So many worms are there, like pinworm, hookworm, roundworm. But this particular ova, the egg is there, they will identify, okay, you have a hookworm infestation leading to anemia. This is one motion test. The second is blood test. The blood test will show anemia. And the other peculiar thing is eosinophilia. If the eosinophil count is very high, it could be because of the hookworm infestation, especially when it affects the lung part, wheezing and all. Then very rarely, they have to do other investigations to find out whether you have a hookworm infestations. But generally, if it is a very simple medications like mebendazole or albendazole, even one or three tablets can completely cure the people from the hookworm infestations. So for the carry home messages, don't walk barefoot, especially in a damp soil, whether it's a domesticated area or in a forest area. Number two, no more open defecation. Number three, try to avoid pet animals or treat them properly, deworm them properly. And if you have anemia, always look for these hookworm infestations and get yourself treated. Thank you.